This patient is having 3 to 4 millimeter pupil dilatation. Insertion of B-Hex Ring as pupil expander device was planned. Dispersive viscoelastic was inserted in the anterior chamber and below the iris to make space for the ring. The ring was held with B-Hex forceps and inserted into the anterior chamber. As I was inserting the B-Hex ring, in the first part it went smoothly, but later on the right side flange notch got stuck in the incision. I tried to release it from the incision. Left side it got released and inserted inside. Right, it was little difficult to disengage and insert it. As this was my first B-Hex ring insertion, so I had done my own set of mistakes. I went ahead with tucking the flange containing hole into the pupil margin, thinking that the ring will come along with that maneuver inside the AC. Instead of tucking it, I should have pulled the ring first inside the eye and then should have tried to insert the flange. I pushed the ring inside the AC. Instead of pushing, I should have pulled because it could have damaged the ring. I noticed that one of the notch of the flange was not tucked nicely into the pupil margin. I went ahead with re-tucking of the flange into the pupillary margin. I held the flange at the central hole area and tucked the flange into the margin. This time both the notches I could tuck nicely. Through the side port, now the second flange of the B-Hex ring was tucked to the pupillary margin. Again I held the flange at the central hole area and tucked both the notches to the pupillary margin and released it. Before inserting the third flange, I inserted the visco below the iris. Similarly, I went through the side port, held the flange through the central hole area and tucked the notches to the pupillary margin. Again I noticed that I ended up tucking one notch. So again I held it to the central area and tucked both the notches to the pupillary margin. After inserting the IOL, the anterior chamber was filled with viscoelastic. Y manipulator was tucked into the flange and it was released from the pupillary margin. I went ahead with the B-Hex forceps, released the right side notch and left side notch, but unfortunately the left side notch was not released. I should have disengaged all the flanges first and then removed the B-Hex ring. After reinserting the visco, I disengaged the notch from the pupillary margin using Y manipulator. Then B-Hex ring was held at the central hole area and removed from the eye. Thank you for watching.